ay mag-subscribe at i-click ang notification bell upang kayo ay ma-update sa mga bagong labas na videos na maaaring makatulong sa inyo para sa sarili ninyong pagpapaunlad.
Hello everyone, welcome back to another discussion and activity, but before that, please do subscribe, and hit the bell button, for you to notify to our new video lesson.
Hey there. Subscribe to my channel. And also press this bell icon.
For this video, we are going to talk about first aid under your physical education, quarter 1, week 4 to 5, module 2. I am sure that at your age, you are all physically active and that you engage yourselves in different physical activities like exercises, dancing, and of course, sports activities. As you do such, for any reason you encounter emergency situations, and it is therefore necessary to equip yourselves with knowledge on applying first aid to the different sports activity injuries. If an emergency occurs in the school environment, in your respective home or open space, being a vulnerable observer to any emergency scenario can worsen the circumstance. This is the very reason and the significant thing that people should have at any rate a piece of essential information on first aid. What is first aid? First aid is defined as an immediate care given to a person who has been injured or suddenly taken ill. It includes self-help and home care if medical assistance is not available or delayed. I just would like to emphasize that first aid is just temporary and medical attention is to be given still, and it will depend sa kung gaano kalala yung injury na sinapit ng ating biktima. We have the goals of first aid. The first goal is to alleviate suffering. One of the main objectives is to be able to help to reduce or totally alleviate suffering. Gagawin natin ang first aid para mabawasan ang sakit na nararamdaman ng ating victim. Take note of that. The second one is prevent further injury or danger. Also, sometimes called prevent the condition from worsening or danger of further injury. Ito gagawin natin yung first aid para hindi na lumala pa yung damage or injury bago dalhin sa hospital for a proper medical attention. And then the last one is to prolong life. Ito yung pinaka-importante sa lahat, that is to save the life of the victim. Anyone can give first aid. Kaya kailangan meron kang knowledge kasi hindi mo alam kung kailan ito mangyayari at kung saan. For you to be a good first aider, you need to have the different characteristic. The first one is a first aider should be gentle. First aider should not cause inflict pain as much as possible. Maingat ka dapat. Of course, andun tayo sa ideya na minsan matataranta o kakabahan, but bear in mind that you need to still be gentle at huwag mong ipahalata sa victim na ikaw ay ninenervyos na. Mahalaga kasing makuha mo ang tiwala ng biktima para mas madali mong maisakatuparan ang iyong gagawing pagtulong sa kanya. The second one is to be resourceful. A first aider makes the best use of things at hand. Being resourceful is that kaya mong bigyan ng paraan o solusyon ang kawalan ng gamit during emergencies. Siyempre, hindi ka naman siguro all the time ay nakaredy sa mga gamit mo. So, marunong ka dapat tumingin sa mga aring pamalit or available materials sa iyong paligid. The third one is being observant. The first aider should notice all signs, aware of what is happening and what may happen. Dapat nakikita mo ang mga posibleng mangyayari batay sa kalagayan ng biktima. Hindi ka manghuhula kundi kailangan mong suriin ang lagay o gaano kalala yung injury sa iyong pasyente. And then the next one is tactful. Okay? Handling the victim with utmost care and in calm manner. Gaya ng sabi ko kanina, kalmado ka lang dapat para siguradong tama ang ginagawa sa biktima at may kalakip itong pag-iingat. Next is, a first aider should be emphatic. Okay? He should be comforting. Marunong ka dapat mag-comfort. Hindi yung habang binibigyan mo siya ng first aid ay sinasabayan mo naman ng sermon o nagagalit ka o tinatakot mo ang biktima. Iparamdam mong nandiyan ka para siya ay tulungan at sobrang napakahalaga yung ideya na yon. And then the last one is, a first aider should be respectable. Okay? Maintains a professional and caring attitude. Of course, gagawin mo ito ng may respeto, and by all means, you need to protect the victim not only from danger but all throughout. So those are the characteristics of a good first aider. When conducting a first aid, bear in mind the acronym AID or AID. A asks for help, and then I stands for intervene, give appropriate interventions, may gagawin ka na dapat, and then the last one is D, and that stands for do no further harm. The most common sports injuries are sprain, we have the heat exhaustion, fracture, and muscle cramps. So ito yung mga pag-uusapan natin ngayon kung paano gagawin yung first aid sa mga ito. Okay? Una sa listahan na pinakamadalas na disgrasya during sports activities ay ang sprain and strain. When we say sprain, this is a result from overstretching or tearing a ligament, a tendon, or a muscle. It affects the ligament that supports our joints. Madalas itong nangyayari sa ating mga ankles and knees. What are the common symptoms? These are swelling and bruising. Okay, yun yung mga sintomas. We also have the strain. Strain is a twist, pull, or tear of a muscle or tendon. It occurs when a muscle or tendon is overstretched or overexerted. This is injury of the muscle. Madalas, ito ay nangyayari sa ating mga leg muscles. And the common symptoms are pain, muscle spasm, and loss of strength on the injured part. Take note that when you are applying a first aid, it is important to always remember RICE or the RICE principle, wherein R stands for rest the injured part of the body, meaning you don't have to move the injured part for at least 24 to 48 hours after the injury happened. I stands for ice or applying ice packs or cold compress for up to 10 or 15 minutes at a time every few hours for the first 2 days to prevent swelling, or at least 4 times a day. And then C stands for compression. Okay? Wearing an elastic compression bandage for at least 2 days will reduce the swelling of the injured part. And then the last one is elevation. Keep the injured part elevated above the level of the heart to reduce swelling. So kailangan alam mo yung RICE principle. For sprain, first, loosen the footwear and immobilize the ankle. Ibig sabihin, tatanggalin mo yung sapatos Dahil for sure, kapag ikaw ay nag-i-sports activity, naka-shoes ka. So, tatanggalin mo yon and do not move the ankle or the injured part. And then after that, you apply the RICE principle. Give analgesics such as ibuprofen yon. And then do not apply heat in any form for at least 24 hours. Kasi yung first 24 hours ang ina-apply dapat natin ay ice. Because applying heat will increase swelling and pain for the first 24 hours. And then for sprain, of course, apply the RICE principle. Okay? Do not apply heat during the first 2 days. Use paracetamol for the first day of injury to reduce pain without increasing bleeding. If arnica oil is available, apply it to reduce swelling. After 48 hours, start moving the affected limb gently and gradually increase the range of motion. Let the pain be your guide. We also have the fracture. Fracture is a bone injury. It is a break in the bone that can occur from either a quick one-time injury to the bone, okay, or from repeated stress to the bone over time. That is what we call stress fracture. There are two types of fracture, namely simple or closed fracture, and then the other one is compound or open fracture. For the simple fracture, as you can see in the picture, it does not damage the surrounding tissues and does not penetrate the skin. Kumbaga, nagkaroon lang siya ng breakage. Okay? And then, mas malala yung compound or open fracture kasi maaring kita na natin yung bone dahil nakaangat na siya from the skin that surrounds it. Okay? Ito pwedeng lumabas na siya. The symptoms for fracture are we have intense pain, swelling, and of course deformity, lalong-lalo na kung ito ay open fracture. For open fracture, dudugo ito since hindi na lang yung bone ang damage kundi pati na rin yung muscle at skin dun sa injured part. Okay, so syempre may dugo yan. So what are you going to do for a fracture? First, immobilize the affected area. Huwag mong galawin. Okay? Keep the limb in the position you found it and place soft padding around the broken bones. Splint the injury with something rigid such as rolled up newspaper or magazines to prevent the bones from shifting. Okay? Para hindi lumala yung pagka-crack ng bone, lagyan mo siya ng splint. If there is an open injury, cover it with a clean gauze pad. Apply pressure to control bleeding. Kasi magiging kalaban mo dyan yung dugo. So, after applying that, you get a medical attention immediately. Don't give the person anything to eat or drink in case surgery is needed. Okay. Then the next one is the muscle cramps. Ito pag nagbabasketball, ganon. Muscle cramps is a strong, painful contraction or tightening of a muscle that comes on suddenly and lasts from a few seconds to several minutes. Masyadong masakit to at hindi parang mahirap siyang igalaw. What are you going to do then? First, stretch the cramped muscle and gently rub it to help it relax. Try pulling the top of your foot on the affected side toward your head while your leg remains in a straightened position. This will also help ease a back tie or hamstring cramp. For a front thigh cramp, use a chair to steady yourself and try pulling your foot on the affected side up toward your buttocks. Okay? Use a warm towel or heating pad on the tense or tight muscles. And then the last one is give conscious victim water or drinks with electrolytes and carbohydrates as much as he wants it. We also have heat exhaustion. Nangyayari ito kapag masyadong matagal ang pagkakababad under the heat of the sun. Heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Now, for heat exhaustion, here's what you're going to do. Have the victim lie down with his or her feet elevated at least 8 to 12 inches in a cool place. Keep the victim cool. Okay? Hanggat maaari, dapat meron siyang ear na nalalanghap. Then remove excessive clothing and loosen tight clothing at the neck and waist. Give the victim electrolyte beverages to sip or make a salted drink if the victim is conscious. From that, monitor the victim for signs of shock. If the victim starts having seizures, protect him from injury and give first aid for convulsions. If the victim loses consciousness, give first aid for unconsciousness. So that's it. I think you are now ready for your activity under your PE.